It quietly drains what healthcare needs most: the full potential of its people.
This is Stepping Up Healthcare. Your host is Tack, and the mission is simple: build your capability and curiosity to make healthcare better.
Today we're talking about non-utilized talent, or non-utilized potential, you might hear it called. Answering the call of academia, a lean textbook would tell you that non-utilized talent is when people's skills, creativity, experiences, and insights are not used to improve the work or outcomes. In healthcare, this waste doesn't usually Kool-Aid Man into a room, busting through the walls, waving red flags, and sounding the alarm. It's actually quite the opposite, and much subtler. It's the quietness and submission that's the signal. This waste has deep company cultural aspects to it. It asks questions that are seemingly easy to answer, but are actually really hard, including, do we actively provide space for staff to come forward with improvement ideas? Do we close the loop with staff members? Do we truly listen, act, and recognize contributions? I would say answering these questions truthfully and generically for all healthcare, the answer would be kinda or not fully. Question 1, do we actively provide space for staff to come forward with improvement ideas? The key word is actively. Not generically, not broadly, what should we do better, but more like, hey, Tim, how would you change this process? Question 2, do we close the loop with staff members? Good news, I think yes, we do that really well in healthcare. But bad news or no news, generally I don't think we do that very well. Question 3, we truly listen, act, and recognize contributions. I think we do well in a broad sense. Thank you all for your contributions, but I'm not sure that we pinpoint specific people very well and lift them up. Non-utilized potential doesn't create a line of patients or a stack of supplies. Instead, it quietly drains what healthcare needs most: the full potential of its people.
Why does it matter?
Number 1, lost ideas. The people closest to the work see the problems earliest, quickest, and clearest, and can also see the fixes. When their insight isn't collected, improvement ends up being a game of darts where we're blindfolded. We're just throwing stuff at a wall and hoping something sticks. Number 2, lower engagement and burnout. Nothing empties the tank faster than realizing that your brain is optional. There are tasks and activities in healthcare that are monotonous and you could do them in your sleep. And that's fine, some tasks are going to be that way. But we want active and engaged minds that are critically thinking. Engaging the staff and trying their ideas is not only getting at valuable information, but also helps develop them and build their capability to see and solve more problems. And then it's not solely on the nurse manager to solve all the problems. Number 3, lack of praise. Non-utilized talent often leads to a lack of genuine recognition for people's abilities and accomplishments. When skills are ignored, praise becomes shallow and disconnected from real contributions. And number 4, hides the problems. When talent is not utilized, employees disengage, ideas are lost, and trust erodes. Over time, people stop offering their best thinking, not because they lack ideas, but because they have learned those ideas won't matter. Why put in the energy when nothing is going to happen? That means that not all issues and problems are raised, but buried, never to be called out.
Let's talk about some real-world examples.
Like I said earlier, It's hard to pinpoint real, actual examples because they can be so subtle. So pulling in real examples is hard, but here's a mix of generic and real examples. First example is infection preventionist who only collects data like hand hygiene and PPE compliance, but isn't utilized to help with HAI prevention for each unit. Another example is someone invents a clever workaround that avoids a daily glitch, but no one asks why the glitch exists. So that workaround just becomes permanent and the problem stays forever. Third example, death by committee. Someone raises a reoccurring supply issue, and the answer is, great point, let's put it on the agenda for next month. Really? Next month? For a problem that happens every day. So this comes from personal experience. Helping somebody with their huddle and huddle board, we had an area for staff to put feedback, opportunities for improvement, things that have been getting in the way. And I had a nurse manager literally tell me, well, we've always done it this way, and took the idea off the board and threw it in the trash. That broke my heart. The suppression of ideas and the suppression of concerns hurts me in ways that I can never express. All right, so 2 little truths that matter that go unspoken sometimes. Number 1, even if you're used to working on the floor, you still have to go and see. Something funny happens when someone becomes a leader. We remember how the work used to be, not as it is today. Even if you are a nurse on that exact unit, even if you can walk through the clean hold blindfolded, care evolves, workarounds mutate, documentation changes, staff adapt. Reality shifts constantly. No amount of past experience gives any leader X-ray vision into the current state on their unit. The only way to understand the real work is to go and see the work happening now. Not as a surveillance or an audit, not as checking, but with curiosity. Where I work currently, we have some great nurse managers and nurse directors. Very knowledgeable, great to work with. But they have not been at the bedside in at least 10 years. A lot changes over 10 years. Healthcare is so complicated and complex that over time, over the years, care is going to evolve. But when leaders reconnect with the work and their staff, they come out of the office and onto the floor, they discover people's hidden strengths, those clever problem solvers, and the hidden problems that ail their staff. Number 2, frontline involvement isn't free. Leadership must create the space. Here's the hard truth. Involve bedside staff. That is inspiring and makes great marketing material, borderline propaganda. But expecting them to get involved in between med passes, admissions, discharges, code blues, code browns is unrealistic. This work should not be additional work. It should be, and needs to be, part of the work. Clearly put, frontline involvement requires protected time. We need to have a serious conversation about indirect time, the amount, what it is, what it should be, etc. And time is something middle managers can't just conjure up with a snap of a finger. This doesn't lie with nurse managers only. It's an organizational responsibility. Senior leadership has to approve the time. They have to see the value in the time. Schedules need to bake in the time. We want your ideas. Must come with actual support and following through. not become a reoccurring campaign tagline or a bunch of broken promises. Managers create the invitation and elicit the engagement. Senior leadership creates the conditions. And those conditions only work when there's a real system of work behind them. Consistent structures, consistent escalation pathways, and expectation setting and communication. This makes the involvement normal, not exceptional. That's how we unlock potential without burning people out.
Homework time.
Here's your tiny assignment for the week. Notice one moment where you, yes, you, have an idea that would make the work easier, safer, clearer, or more efficient. Then ask, what is the problem that we need to solve? And then ask yourself, why haven't I shared this? And what's getting in my way of sharing this? What would make it easier for me, or anyone, to bring this idea forward? We don't fix this waste by shouting for more creativity or just a generic call to arms. We fix it by improving those communication pathways, by listening to our staff, acting on their contributions, and closing the loop with our staff. That's all I got for you today. Next episode is about transportation waste. I'm Tack. You're appreciated. Let's step up healthcare.